Welcome to this edition of AFMC
I'll tell you how I got better.
Glad to be here.
But a mission to
Delivery. Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Bo Ryle, and he is the Arkansas Hospitals Association President and CEO. Thanks for joining us.
Thank you for having me, Robin. Appreciate it.
Tell us about the Arkansas Hospitals Association. What is it?
So all the hospitals in Arkansas are members, so it's 105 member hospitals. And so that could be your traditional hospital, like an acute care hospital. It could be a long-term acute care, rehabilitation hospitals, psychiatric hospitals, and we do have a hospice member. So we've got a wide range of healthcare facilities that we represent.
And what are the main ways that the organization supports them?
So advocacy and government relations. So we work with state and federal legislators and government agencies as far as shaping regulations and laws that are helpful to hospitals and helpful to patient care. So it improves patient care, but also the financial viability of hospitals because we depended on Medicare and Medicaid for payments. We also communicate that to our members because there's so many myriad of laws and regulations that govern healthcare and hospitals. So we want to get that out to our members and have so they know exactly what's changing because it changes daily. And then we do education for not only the CEOs, CFOs, COOs of an organization of a hospital, but also the people who work in hospitals. So the nurses, we do continuing education there, and you wouldn't think, but the engineers need continuing education, the human resources, the purchasing agents. So we've got a lot of different groups that we provide continuing education to. And then also we're not new, but somewhat new is a data program that we're working on for hospitals. So throughout my career, I've thought it interesting that researchers and policymakers think that hospitals are this huge data repository and they can just ask for something and we can just provide it to them. Well, that's not really true for hospitals. So we've been gathering information for years as far as a hospital and patient records, but to be able to provide that in a way that's useful to hospitals and researchers and policymakers, that's kind of new for us. So we have a data program that we can provide data back to hospitals so that they can look at patient care and how to improve patient care. Also the financial viability of some services. So they could look at a service line and say, well, this is really working for our hospital. We need to expand it or we need to move on from it. So we also have a quality program that we've got 3 nurses who work on our team. So working on that.
And not many people know about the quality program and it's in patient safety initiatives that hospitals are engaged in. It's a lot of work.
Yes, it is. Yes, it is. So as I said, we've got 3 nurses who work on our team. We've been servicing federal government contracts since 2012. So we're working on reducing hospital-acquired conditions. We're working on reducing readmissions to hospitals. So there's big movement from the federal government to do those things, and we want to do those things and help out. So we've partnered with the Arkansas Foundation for Medical Care on some of those contracts and the Texas Medical Foundation. So I think what's good for us to see is the different forums that we create. So not only are we the boots on the ground talking to hospitals and their quality teams, but providing a forum for them to get together and to hear best practices that we think work, but then also for the hospitals to say, wait a minute, we've tried that in our hospital. This is what works best for us. Maybe you should try this to deal with a different type of infection or falls or to help with readmission. So those things are helpful, but also we've created recently a patient and family engagement council. So obviously we're bringing in former patients and family members to hear their experience in a hospital healthcare setting so that we can learn from that and provide that experience back to hospitals. So in thinking about how all of this affects our advocacy part, knowing that what works and what doesn't work in a hospital. So policymakers, government regulators, government agencies, they're passing all these regulations and laws, and sometimes they can be duplicative. Sometimes they can be, we're spending more time on paperwork than working at the bedside. So a big goal is to try to reduce all that paperwork and all those regulations in a way that it improves patient care, but also keeps the healthcare provider at the bedside and working, not just filling out paperwork.
And there has been a lot of talk in the news about hospitals closing or limiting services. Are you seeing that? I mean, what is the cause of it, and are you seeing that?
Yeah. So I guess we all had this line of pre-pandemic, post-pandemic. So pre-pandemic, Arkansas was one of the first states, particularly in the South, to take advantage of the Affordable Care Act and the additional health insurance that's available through Medicaid. So over time, we've had 250,000 to 300,000 people take advantage and be a part of this Medicaid expanded health care coverage. So two parts. So it helps the patient have better health care. But the second part is patients went from 250,000 to 300,000 uninsured to insured, so the hospitals and the doctors are now getting paid for those services. So what we've seen in other states that didn't take advantage of this, they've seen hospital closures, over 100 in the southern area, but Arkansas has not seen any of those closures because of that. So then we go through the pandemic, and hospitals provided all kinds of services, equipment to try to help people during COVID and to service those patients. We did get reimbursement for the government for some of those services, but as we left the pandemic, we saw inflation, supplies go up 20%, labor costs go up 30%, pharmaceutical costs go up 20%. So you're looking at costs going way up here, but reimbursement is still down here. So we're not like other industries, say a restaurant, where we can just raise prices to meet cost. For hospitals, we're paid by Medicare and Medicaid, which Medicaid has been flat in their payments. Medicare has gone up a couple of percentage points, but not enough to keep up with inflation. So now we're to commercial insurance, which those are private contracts that are negotiated. And I think what we're seeing now is that pressure from no increases from Medicaid and Medicare or limited increases has put more pressure on those commercial insurance contract negotiations. So you might have seen in the news where a particular hospital has gone out of network with a insurance company. So they're in negotiations, and those negotiations are more public than we've ever seen. So there's a pressure there as far as reimbursement, and it's really the pressure of making hospitals financially viable during this time, because it is really a tough time because of inflation.
And are you seeing that in rural areas specifically in the state?
Yes, we are. We've seen a lot of, the rural areas are more dependent upon Medicare and Medicaid, so, and rather than private commercial insurance. So there's that pressure there of working with Medicare and Medicaid and providing a better rate.
And you talking about changes of care, are you going from where they become like a critical access facility, or to where that there's more of a wider range of care to where they're having to travel farther to get that critical care?
Well, I would say the risk of closure certainly provides that access to care concern. So if a hospital closes in a small town or a small county, then you're looking at maybe a 30, 45 minute, an hour drive to have access to a hospital or a physician. So that's a big concern with hospital closure. Also, when you think about a hospital closing, you think about, well, the patient care that's there that's going to be missed, but you also think about the economic impact. So in most communities, the hospital is the largest or the second largest employer. So having that in a community certainly means that the community is more viable, the community is more successful, the jobs are there, the income is there, so it really helps the community. But also when you think about economic development, so if a industry is looking at a community to move in, they certainly want to see a hospital there. They want to see healthcare facilities. So besides the patient care that a hospital provides, it's the economic development and economic impact on that community.
It trickles down in a lot of ways.
It certainly does.
Yeah. So are there any challenges that are unique or more severely felt by rural hospitals? I mean, you touched on that a little bit.
Yeah. Well, I would just say to add to that, small hospitals, when I talk to CEOs of a small hospital, they say how difficult it is because they have to know how to do everything. And the margin of error is so slim. And when you compare that to a large hospital system, if they make a mistake, certainly they can overcome that. But when you're in a small hospital and the profit margin is below or right on the line, if you make a mistake, that could certainly result in the closure of that hospital. So the same challenges are there. It's just so minute there for those small hospitals that they have to really pay attention to. And it's a tough job. There's no doubt about it.
And you mentioned workforce challenges being felt by all hospitals, but especially those rural hospitals. How do these obstacles inform your advocacy work?
Well, we learned a lot of things from the pandemic, but one thing we learned about workforce is that for salary and wages, it is difficult for Arkansas to compete and go out and go to Dallas and try to get nurses and physicians to come in here, mainly based on salary. Now, we provide other great things, but salary, it's hard to compete. So we have to find ways to get people interested in healthcare careers and get them in the pipeline. So we've seen that a report that we did last year showed that we're 9,000 nurses short. So that's hard to overcome. We can't go out there and just buy them and bring them in. And we saw that with the travel nurse industry, that was just too much. The costs are just way too prohibitive to do it that way. So we've got to, if you will, grow our own in Arkansas and grow our own in the community. So we've got to get to middle schools, junior highs, high schools, and talk about healthcare careers. And that is a great way to make a living. It's a great career. It's very satisfying, and it's a way to keep you in the community and keep you in the state of Arkansas, which we all love and want to stay here.
And what is a rural emergency hospital, and is the introduction of that designation a positive change or a negative for the state?
Well, I think it's a positive change. So the federal government made this available. So you mentioned critical access hospital. That's another small hospital designation. But a rural emergency hospital has been implemented in the last couple of years. And so instead of providing inpatient, outpatient, and emergency department care, a rural emergency hospital does not provide inpatient care anymore, but they provide outpatient and emergency department services. So what we've seen at the smallest of the small hospitals that are right on the line of staying open or closing, this is an option for them to pursue in their communities to have healthcare access available to them. I think it's a positive because we're not converting a hospital that's seeing 25 inpatients a day. No, we're converting one that has limited inpatients per day, and so it still provides the services to the community, and still is a hospital there in their community.
Well, thank you. Thank you for talking about this important information and sharing what the organization does. And I have no doubt that what the organization is doing is beneficial for Arkansans. Thank you.
Well, thank you, Robin. I appreciate it.
Yep. Today I have with me Patricia Fry, and she is the Associate State Director of Community Outreach and Engagement for AARP Arkansas. Patricia, thanks for being here.
Thank you for having me today.
So tell me, what is a livable community as defined by AARP?
So I always tell people, just think about what it says, a livable communities. It's really how you define how you live as you continue to age. And so one of the things that AARP advocates for is housing that is comfortable, but also affordable, because you can think about how your income continues to change as you go up in age and as you move forward. You know, you may lose some income because you're no longer working, or you decrease your hours at work, whatever it may be, but you want to make sure that your housing is affordable in your community. The other thing is that we want to make sure people can get where they want to go when they want to go. We want to make sure they have access to public transportation. We want to make sure you have sidewalks in your community and that your communities are lit. You have parks that you can go and be with your family, your grandchildren, your friends, or your animals. But also, we want to include vibrant and safe public spaces. We want to ensure that you feel safe in your community. And so those things all pour into the bucket of a livable community.
And does Arkansas have livable communities? I mean, are there certain pockets of the state that we're seeing that in?
Arkansas is doing a great job, and they're really, particularly here in the city of Little Rock, they're really looking at their communities and what they have available. As you know, there's a huge plan that just rolled out by the city of Little Rock, and a lot of the communities here, they're taking a look at those neighborhoods. I know we were recently in Petaway with America Walks, and we did some work there in that neighborhood to ensure that traffic is slowing down a little bit so it's safe and that people can walk or the cars can safely travel throughout the neighborhood for pedestrians. But the city of Little Rock and all the surrounding communities across Arkansas are doing great jobs of taking a look at those communities. So yes.
And you all have what's called a livability index. Tell us what that is.
Yes, so the livability index can be found at aarp.org website, or you can actually Google livability index and just put in your city and state. And so basically what you'll find is that we looked at neighborhoods and communities across the U.S. and scored them based on services and amenities that they offer in their communities. And so you can go in and put in Little Rock or Fayetteville or Jonesboro or any of the cities across Arkansas, and you can pull up that score and then read information about how it was judged or how it was scored, and how they came up with that score based on amenities and opportunities and things of that nature in that community.
So, and it's varied on, the scores are varied on sidewalks and transportation, all the things that you mentioned before.
Yes.
So what would you say comparatively, like nationwide, Arkansas has a pretty good livability index score?
So. I think it really does. I recently looked at it, and it does change, but I think the score that's posted now is very comparable to cities across the United States. Yes.
Oh, that's interesting.
We're doing a great job
Doing
here.
something right.
Yeah, we're doing something right.
That's good. So what else does AARP have ahead for livable communities? You guys have some cool projects on the horizon.
We do. And it's all about timing. So we're working on our schedule and our calendar now, and everything can be found on our website. But some of the things we're going to be working on is disaster services. And so we want to ensure that people of the 50 plus community, but anybody really, but particularly 50 plus because that's our target audience, that they understand how to prepare for disasters. It's not a secret that we suffer from tornadic activities here in Arkansas. So we want to ensure that our community that we target are ready for when those things happen. So we're going to be doing some preparedness education with the 50 plus community, and also on some long-term recovery education. What are the resources that are available for disaster preparedness? Where do you go when you do have a disaster, a tornado or a flood or anything of that nature? And so we're going to be doing some work this fall that's coming up starting in October and November, and we're going to prepare for the 2025 tornadic and storm season. We're also going to be doing some digital equity training. We're working with our OAKS program out of Nashville, AARP, and so they're going to offer 6 or 7 webinars this year. They're also going to start in June or July. We're going to do once a month, and so we're going to announce those to the public. They can log on to this webinar, and they're going to tackle different topics. Some of those topics are going to be just basic. How do you navigate the websites? How do you get on and speak with your doctors when you need to? A lot of things now, prescription-wise, are on the websites. You have to be able to log on. You have to be able to navigate those websites. And so we want to ensure that we can do that with telehealth. We want to ensure that we can train you just how to do the basic navigation. So there'll be various topics offered every month, and we're going to start that. And we're really excited to bring that to Arkansas.
Yeah, those are great projects.
Yes.
And each year, AARP also offers something called Community Challenge Grants.
Yes.
Tell us what that is.
So the Community Challenge Grants is really awesome. We're right now in the judging period for the grants that were recently submitted. So basically, and I want to tie that into our age-friendly network because I'm really promoting going across. I'm doing a roadshow tour, so to speak, across Arkansas, and I'm going and I'm promoting communities to become a part of the age-friendly network. So within that network, you'll receive great information about how to become more age-friendly, how to become more livable. You'll be able to start working on some of those projects. You'll be able to do an assessment of your community and create an action plan, and then we're there to support you with that action plan and getting some of the projects completed in your community. So if you want to do a community garden, or if you feel like you want to do a traffic assessment in your community, it could be anything like that. We're here to support you. Within the age-friendly network, you have an opportunity to apply for community challenge grants. You can apply for it even if you're not a network member. We really want our network members to get involved and apply for these community challenge grants. CALS, a local library system here, they actually applied for a grant and they were awarded. And I think they were going across and doing some digital training with the public, and they did like a digital tour across Arkansas. So it's been very successful. But those grants allow you to have funding to support whatever project it is. So if you have a project for your community, so you want a better health services in your community, access to health services. If you want to look at your sidewalks in your community and you want to work on that project, I'm encouraging you to become a part of that network when we start to come into your city. And you can find the information on our website again. But also, I encourage you when the grant seasons come around, apply for those grants. That's funding that's available, that's assets out there for the communities. Mm-hmm.
Well, it sounds like it's a wide array of types of things and projects. So maybe even the project that fits that community.
Yes.
There's not really a whole lot of that you could say no to in terms of how that is going to help that age demographic.
Correct. And we get to submit about 10, I think, awardees that we want to nominate to receive funding every year. And so we're excited to do that this year, and we'll be doing it again next year. So we make the awards in the springtime. So this year, when you start to get the word, we'll start to get the word out. When the public hears about that, please apply for those community challenge grants.
Very neat. And this sounds like we're talking a lot about livable communities in the work of AARP, but you guys need some help. You need volunteers.
We do.
So tell us what you're looking for.
Yes, I have a huge mission. So my mission is to make the communities of Arkansas more livable. I can't do that alone. We're a very small office of 4 full-time staff members, and so we rely on volunteers. We have a great family of volunteers right now, but we need more people. And you don't have to be 50 plus. People think they do. We take volunteers of all ages because there's so many things that you can do, so many projects and events and activities, programs that you can support. We have veterans teams that people don't know a lot about. We have our community outreach team. We have communication volunteers. We have office volunteers. It takes a lot of people to do the work that we do. So we're looking for more volunteers. And so please, if you're looking for hours, if you're a student looking for service hours, if you're just looking to give back to your community, we encourage you to come and volunteer with AARP Arkansas.
And your website, as you mentioned, has all types of resources from livable community information, volunteer, programming, all kinds of different things that you can find there.
It does. And you can find all the information that I mentioned here today and more on our state's website. But you can also find the links to sign up to become a volunteer. Yes.
Hey, Patricia, thank you. Thank you for talking about these unique grant opportunities and what Arkansas is doing right with livable communities.
Thank you for having us. And I look forward to seeing people come and sign up.
Yes, I hope you do.
Thank you.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.